Schizophrenia is a mental illness that can cause a range of symptoms. Symptoms of schizophrenia are put into two categories, being positive and negative symptoms. Negative symptoms are things that are normal in a healthy individual that schizophrenic patients lack. These are things like lacking social interest, lacking facial expressions, and having slowed speech and thoughts. Positive symptoms are symptoms that are experiences that schizophrenic patients have that a normal person does not, including hallucinations and delusions. Hallucinations are thought to be the keystone of schizophrenia, and they are sensory experiences that are not real. Hallucinations usually come in the form of either seeing objects, people, or things, or hearing voices inside their head. Delusions are irrational thinking patterns. Two very common delusions are the delusion of grandeur and the delusion of persecution. The delusion of grandeur basically leads them to believe that they are superior to everybody else, and a lot of times they think that they are or should be famous, or that they are in fact God. The delusion of persecution is the belief that someone or something is causing you or is going to cause you harm. Two common beliefs under the delusion of persecution is either that the government is after you or that aliens are after you. In a study published in 2019, scientists placed schizophrenics into three subgroups, being high symptom burden, predominantly positive symptom burden, and low symptom burden. High symptom burden were patients that experienced both positive and negative symptoms. Predominantly positive symptom burden patients had mostly positive symptoms, and low symptom burden patients had mostly negative symptoms. Based on the symptoms that a schizophrenic patient has, they will experience the world very differently. So the scientists in this experiment looked for a biological reason for that. It's commonly known that schizophrenics have a smaller brain size than a healthy individual, but the scientists in this wanted to see if the brain sizes were different for different schizophrenic patients depending on what symptoms they had. So they used an MRI scan to assess the cortical thickness of different areas of the brain, and they were actually able to conclude that depending on what kind of symptoms you had, the cortical thickness of your brain in different areas of your brain was going to be different. Although it's definitely interesting and definitely valuable to understand that the brain structures are different for schizophrenic patients, I think it's also important to understand the behavioral aspects of a patient and how they are able to live their everyday lives and their independence and their ability to perform everyday tasks. In a study that was published this year, they looked to assess patients living in an inpatient treatment facility for schizophrenia on their ability to accomplish everyday tasks. These tasks included making a bed, doing laundry, folding laundry, loading a dishwasher, unloading a dishwasher, and cleaning. There were a total of 17 patients in this experiment, ages ranging from 18 to 56. Their ability to accomplish these tasks was measured using the AMP scale, or the Assessment of Process and Motor Skills. This scale accounts for the amount of effort it took the patients and the amount of assistance that was needed. A brief psychiatric rating scale, or a BPRS score, was used to rate each participant in the amount of symptom interference they had while performing the tasks. When comparing both scores, there was a high correlation in the amount of effort and amount of assistance needed in completing a task and the amount of severity and the symptom interference while completing the task. It's definitely important to acknowledge the abilities of each schizophrenic patient, especially as the symptoms of each patient can be so different, whether it be predominantly positive, predominantly negative, or a combination of both. Depending on their abilities and what kind of symptoms they have, it can greatly alter the treatment that's going to be used and the extra therapies that may be put in place. As only 1% of the population is schizophrenic, it can be very difficult for us without schizophrenia to understand what it might be like to have schizophrenia. To help you understand a little bit what it's like, especially with the positive symptoms, I've put together this short simulation so you can understand a little bit more what it's like to be schizophrenic.
Are you gonna drink that?
You're gonna drink that.
You know it's poisoning you.
Put it
And
down.
it's gonna kill you. Don't touch
Don't be
it.
stupid.
Don't touch it.
Don't drink it.
Drink it.
You're being so
Drink
stupid.
it. I dare you. Drink
Drink
it.
it. Drink
No.
it.
Don't.
Don't
Put it
drink
down.
it. Don't touch it. Just leave it. Are you gonna answer it? Don't answer it. They're here to kill you. Just walk
Answer
away.
it?
Are you gonna get it? Don't.
Just walk
Don't
away.
open the door.
Don't check who it is.
Who is it?
Don't
Who
let
is
them
it?
see you.
Who is it? Okay. Okay, open it. Do it. Okay, open it. Open it. Do it quickly. Oh, don't open it. Don't open it. Go. Hurry. Let's go. Don't open it. Okay, get it. Grab it. Quickly. Okay, get it. Get in. Okay, back in. Come on. Back in. Close the door. Lock it. Quick! Hey, close it! Lock it! Lock it! Lock it quickly! You're gonna open it?
No, you can't
Don't
open
open
it.
it. You can't.
Don't
What if it's a bomb?
It's a
It could be a
bomb.
bomb.
It's a
Don't
bomb.
touch it. Hands off.
It's gonna kill
Don't
you.
touch it.
They're here to kill you.
It's gonna kill you. You
Get
know
rid
it's
of
gonna
it.
kill you. Just
Throw
get rid
it
of it.
out.
Throw it out.
Throw it
Throw it
out.
out. Yeah,
gotta go.
get rid of it.
It's
You gotta
gotta
get rid
go.
of it right
It
now.
needs
Get rid
to
of it.
go.
Good. It's about you. They know what you did. They know what you did.
In today's breaking news, a young female was seen walking around the neighborhood.
Yep, they're talking about you. She's talking
If you see this
to
individual, you
you.
should notify
She's
authorities
talking to
and
you.
stay far away. Because you are pathetic and worthless, and nobody likes you.
They're watching
The
you.
government
They're
is
watching you.
Close the
They're
curtains.
spying
They're
on
watching
you.
you.
They're
trying to
watching
kill
you.
you. Close the
Get
curtains.
up.
Close the curtains.
Get up. Close them. Get up. You need to close them quickly. You gotta close them. Come on. Come on. It's like all the way. Close them. Before they see anything else. Before they see what you do. They can't see what you do. Close them quickly. All the way. Close them all the way. All the way. Just sit down. Like you do.
So what, you're
all
just
the
gonna
time.
sit
here again? Like you
You're
do every day?
worthless.
You're pointless. Being pathetic.
Such a waste of space.
Not doing anything.
Do something
You're
productive, maybe.
And now everybody knows that you have no
It's 'cause
friends
you're a
and
loser.
you're such a loser. You're worthless. Loser. You're absolutely worthless.